Okay, today we're going to do appointment number 2. So first thing you're going to do is pass the doctor the sickle scaler and the back Howell's teleforceps to remove the temporary crown. They will open these and give it a good squeeze to pop it off. Then we will go in and attempt to remove all the temporary cement. At this point, if the patient cannot handle the discomfort of that, we would have to decide if we were numbing them or not. So if we are numbing, we would go ahead and place our topical, and then we would pass the doctor the syringe. We would then flush and aspirate, and then we would go back in and after they were numb and continue to remove the temporary cement. If we were not numbing them, because they could handle the discomfort, we would continue to remove all the cement, and then we would have them rinse with warm water to avoid the shock of cold water. So you're going to have to decide if you're numbing or not numbing, using warm water or continuing with the numbing and flushing and aspirating. We would then pass the doctor the permanent crown, palm side up, and the doctor would place it in, making any necessary adjustments using burrs, mandrels, and the high speed. We would then take the crown to the lab. We would disinfect it. We would come back and we would begin our isolation. So we would place in our cotton rolls and we would place our Copolite. We would then mix our cement, permanent cement. It could be Duralon, Key-Tech, zinc phosphate, doctor's choice. We'd mix. We would load the crown in a luting motion. We'd pass it to the doctor, palm side up. Doctor would place the crown. We would use the orange wood stick and the mallet, or just the orange wood stick. Patient would bite down, biting the crown into place. We would then have them bite on a cotton roll for 5 minutes. After the 5 minutes, we would remove our cotton rolls and we would use our sickle scaler and dental floss with a knot in it to remove any excess cement. We would take the floss with the knot and we would go down and through as to not pop off the crown. Very, very important step. We would then recheck with articulating paper, and any necessary adjustment would then be made again with burrs. We would then instruct the patient to avoid chewing on that side for the next 24 hours so the cement could harden. And if they were numb, we would tell them to be cautious of the numbness. If they are not numb, we would just instruct to not chew on that side for the next 24 hours. After that, we would schedule their next appointment and remind them if the crown ever comes off to come back, bring it back, and we can cement it back on.